that, I've been in the industry for 38 years. And when I tell friends of mine from the industry, when they ask, what do you do? And I say, I'm the CEO of a nonprofit generic pharmaceutical company, they go like, what? Right? And I said, well, you think that's an oxymoron. Let me tell you the rest of the story. And it starts with, I do this pro bono and I don't take a salary or any financial compensation for the company. And they go, that's unheard of. I said, well, the whole idea about Civica is unheard of. Civica was formed, as you mentioned, by several health systems and philanthropies to address chronic drug shortages. So at any point in time, there's over 250 drugs on the FDA and the American Society of Health System Pharmacists drug shortage websites. And that's been for over a decade. And most of these products are older generic drugs. They're sterile injectables, which means they're very capital intensive to manufacture. They have very strict regulatory requirements that they have to live up to. And they have very strong enforcement, because what we're doing is we're taking the drug and sticking it right into the person's vein, and there's no tolerance for error. So knowing all that, these 7 hospital systems have been frustrated for over a decade, talking with the manufacturers about drug shortages and constantly hearing the same message. We're going to fix it. It's almost taken care of. Next year, we'll be out of this crisis. And after 10 years of hearing that, they were so frustrated, they said, let's make the drugs ourselves. And so that was the formation of Civica, dealing with that frustration. When I joined Civica and talked to the founding members, we've always said, we're going to be a manufacturer. We're going to be a manufacturer in 3 ways. The first and its quickest way to the market is find people who already have the FDA license to make the product, but for some reason, they've decided not to make it. And we've crafted our business model so that those people are encouraged to get back into the market and make more of the product. Second part of the strategy was to develop our own data sets, file our own submissions with the FDA, and use contract manufacturers to manufacture that product. And that process is ongoing. And the third process, which just recently started, was to build our own manufacturing facility in Petersburg, Virginia. We have broken ground. The entire pad has been laid and steel's being erected as we speak today, but all in a focus of having redundancy in that supply chain. So we're not depending on any one manufacturing location, having strategic stockpile of the medicines so we can get through issues like the pandemic, right, where we don't run out, and to keep prices at an affordable rate. And so that's the mission of the company. We're doing what we promised to do. We offer 60 products to our members today, and we'll have within the first 5 years of launching the company 100 products in the catalog. Our plan, we're on target with our plan that we'd be manufacturing in 2023 with our own facilities. So that's always been the plan. Of course, designing and purchasing all the equipment and the land and the buildings, it takes time, right? Then getting the plant approved by the regulators, developing the stability data for the products, it all takes time. It's all going on concurrently in a lot of cases. So we're on target for our objectives. I would say we're not just a purchaser of products. Where we have a difference over other purchasing kind of organizations is, and that's part of our business model, to entice people into the market. And they like what we're doing. So one, we offer them long-term contracts that are guaranteed annual volumes, that if we don't take the product, we pay for it anyway. So it's a take or pay arrangement. Second, we take ownership as soon as they release the product to us, and we pay them upon delivery. Today, in the current wholesale marketplace, when you sell to a wholesaler, A wholesaler does not pay on delivery. A wholesaler pays upon when they sell your product. So a particular batch or lot of product could take you a year to get paid for the entire thing. We pay right away. So paying right away with those long-term contracts, manufacturers now have the resources and the security and the certainty that they should be buying all the raw materials for us, that they don't have to worry about the next order being placed. So we don't have as many, we don't see drug shortages because a supplier had an issue getting materials, because that we're paying for it as we go. We have 12 companies that we're working with. We're very transparent in how we do business. It's matter of fact printed on all our labeling, where it was made and who made it. Some of the companies you would know, like Sandoz and Hikma, and other companies are much smaller or less known companies in the United States, one of those being Exilia. So it just depends.